All right. So, hey, friends, I'm super excited to have my cousin, Dr. Latrice White here on Women Worth Knowing. And I'm sharing this month women that I feel like you should know. And Dr. Latrice White is definitely a woman that is worth knowing. My cousin has her advanced degree in doctor in nursing practice, and she's a family nurse practitioner, board certified. She is the mama of three kids, and she is passionate about healthcare and health literacy. And she's here to share some of her valuable wisdom when it comes to being a woman in her 40s and some health concerns that you may have. So, Latrice, you want to share anything with my friends here?
Well, thank you for having me. I'm happy to be here. I'm happy to talk about something that I'm very near and dear to my heart. So I'm ready.
Yeah. So, like I said, this is my little cousin, which is so awesome to watch her. She's an awesome mom, and she really is passionate about health literacy. During the pandemic, she was sharing so much valuable wisdom as a nurse for people. And so I just asked her to come on here just to share some wisdom on health concerns when it comes to women in their 40s. So, what are some common health concerns that you find women in their 40s experience and ask you as a nurse practitioner?
I think the most common thing that it kind of all relates to, because there's a lot of complaints and everybody is just so uniquely different. A lot of the things that women complain about are the things that they notice every day. So things like uh, their temperature control, their ability to control their temperature, like feeling hot or cold, either hot flashes or just feeling I'm cold all the time, no matter what I'm wearing. Even if it's 80 degrees outside, I got a sweater on.
That's me.
Things like changes in their skin, things that you're gonna, you look in the mirror and you see those things. You notice if your skin feels dry or if your lips aren't as plump as they used to be. You notice those things that you're gonna see every day. Things like even heart palpitations. Some women experience a lot of discomfort when it comes to like regulating their heart rate or feeling their heart beating at times when you normally don't feel your heart beating. And all of those things sometimes can be related to really your hormones and those being imbalanced. I think most of the things that women kind of experience and note about things in their 40s or getting close to their 40s really do relate to the way that our hormones change as we age. And whether what they are specifically, you kind of have to go to your doctor for, but all of those common complaints kind of relate back to your hormones more times than not.
No lie. There's no lie. Like when I hit, I feel like 39 and a half, like right before my birthday, I was like, no, can't be. Like I do all the things that you're supposed to do, but I'm starting, and now that I am 40, I'm like, oh, all the things that they say are true. And so I know for me too, most of my clients are my youngest client is 45 and my oldest one is 63. And so they ask me questions that I always say, go to your doctor first because I am not, it's not my scope of practice. But how can women in their 40s manage on their own with guidance, like knowing I have hormonal imbalance? What are some typical things, I guess, like a standard of practice for managing perimenopausal, which that's like a bad word in my head now because I'm like at that age, and menopause symptoms? Is there something commonly that they can do to start addressing these symptoms?
So, just like you said, you definitely have to go to your doctor to find out what it is because there's so many different hormones in our bodies. And that's really one of the things that kind of feeds into the misinformation about how prevalent and how important, how influential hormones are altogether. Is that we really don't know. We don't know what they are, who they are, what they're doing in our body. We just know we have them, they're doing some things, and it makes our body work. Right? The lack of information about hormones really leads to not doing anything about it or not knowing what to do about it. The one thing or the few things that I can say everybody can do to manage their hormones, really the foundation, the building blocks, like the everybody can do this. Work on your nutrition. And it sucks
Mhm.
because it's the hardest thing to do. But physical activity and nutrition really are the building blocks to building the stability that our body needs to regulate the hormones that we have the natural way. Because you have to go to your doctor to figure out what hormone is imbalanced. just like with your diet, you don't know what nutrients you're deficient in. You just eat all of them regularly, and our body figures out what we do need and what we don't need. So really, the things that everybody can do, if you're at a loss for how to address your hormones, figure out if they're imbalanced, because it may not be a hormonal imbalance, but those are the things that we need to check off to make sure that it's not something more serious. Figure out the basics. But to work on your basics, make sure your diet and your physical activity are the foundation.
That's awesome. Great tips, especially for the fitness professional here. But I have two questions. One is, what are recommended screening or tests should women ask their doctor for, or just their doctor probably would know. But what if you are someone who wants to come into your doctor visit informed, what are some recommended screening and tests that you would recommend for them to ask for?
So first, it's when we talk about screenings for your doctors, ideally everybody would go see a primary care physician or nurse practitioner, whatever, float your boat, whatever's available in your area every year. And it's not necessarily, if you've been going to the same provider for 30 years, you may not need to see them face to face every year, but there are certain labs that you should be having done annually, at least annually, and there are certain things that you should be mindful that it may be time to screen a little bit more significantly. So basic screenings that everybody should be having. Definitely get your blood pressure checked regularly. Make sure that if you're taking medications for your blood pressure, that they're working. And if you're not taking medication for your blood pressure, make sure you don't need any. Simple. Things like checking your cholesterol. So a lipid panel every year is beneficial to know. You want to know if your blood pressure, if your cholesterol is high. If it's low, great. You don't want to know where you are in that though every year. Things like your A1C. You want to know if you're diabetic, if you have a problem with it, if you have a family history of it specifically, but even if you haven't had any history of diabetes necessarily, or you don't necessarily know the symptoms of diabetes, you need to make sure that you don't have a problem with it. And so you get your A1C checked every year. It's simple, just a blood test. PHQ-9, so that's a depression screening. I think it's important for women, even before your 40s, you should be getting a regular PHQ-9 screening, but more so in your 40s, because life changes a lot in ways that nobody prepares you for when you're getting close to 40, that would make most people depressed. And it's part of life and it's nothing wrong with it, but if you let it get out of hand, it becomes a problem. So it's something that you should be regularly checking in with somebody about so that they can help guide you to where you need to be so that doesn't become a problem. Depending on your family history, there's a lot of things that you should be screened for even as early as your 40s, but a lot of them depend on where your family history lies and where you are individually. So if you have family history of people who are younger than 35 that have a prevalence of XY disease, like hypertension, diabetes, some rare blood disease, sickle cell, any of those things, it really requires having conversations, not just with your provider, but with your family too. Because, you and I are family members, but I don't know your medical history.
Right.
I don't know what's prevalent, even in with our own family line. I don't really know what's prevalent because it's not widely discussed. It's still very taboo to know everybody's family history. And we don't need to know every aunt and uncle's toe problem, but we do need to know if there's a blood disorder that somebody may have had, or if some woman in our family had many miscarriages at a very early gestation and pregnancy. We should all know those things because some woman in our bloodline is going to have a problem with that if it's something prevalent that women can experience often, but we don't really talk about. So things like that, trends within your family, those are important to know because there are screenings that people could be getting, and it could be something that's preventable, but we wouldn't know that it's a problem. We wouldn't know how to screen for it if we don't have the conversations about things that are prevalently happening within our family or in our bloodline.
You're so right about that, because I feel like we meet up in person at funerals mostly, and it's like when so and so passed from something and you're like, oh, I didn't even think about that. And so you're absolutely right, having those conversations within the family, not necessarily, hey, can you like give me down your medical records, but like just in general, like knowing this is something that is common in our family. Never even considered that.
And what I know about our grandmother's medical history may not be the same thing that you know about her. Like I knew that, that like maybe it was that she had breast cancer later on in her life, but do we know that that's why she died? I mean, she was in her 80s.
Right.
You know, what specifically do people pass from? We don't really have that conversation a lot of times when people pass in our family, and it's because nobody wants to talk about that stuff. But it's important to talk about it, and even things like, we're talking about women in our 40s or close to our 40s. You know, back when I was in college, I was on birth control for 15 years. You don't really think about how that affects you when you're in your 40s, because maybe in your 40s you haven't been on birth control for 10 years. But depending on the type of birth control you were on, if you were on things like Depo-Provera and you were on it for greater than 5 years, you should be screened to make sure that you don't have osteoporosis, because those birth controls can leach calcium from your bones and can cause problems later on that you're not even aware of. You wouldn't even think it would be a problem because you don't even take birth control anymore. But if you took it for more than 5 years, it's worth getting screened, or at least have the conversation with your doctor about, is it necessary for me to be screened for this? Those are the ones that jump to mind offhand right now.
That's a lot. I'm like, I need to go to the doctor. I need a list of things. So we'll have to talk afterwards. But I'm thinking also with perimenopause, with menopause, those are all reproductive health concerns. Are there some common ones that you've noticed as a doctor of nurse practitioner, with women in their 40s?
So my background, my RN career is usually emergency medicine, urgent care, that type of stuff. So reproductive health is very much specialized. But even given that, when I think about reproductive health, I mean, I don't want to have a baby in my 40s. I'm not opposed to having babies in my 40s. If I had enough money, I have babies, whoo, well into my 40s. But I think what we have to we have to remember when it comes to reproductive ages is that we were born with all the eggs we're going to have, and we're putting out an egg or two every month for 40 plus years. Eventually we're going to run out of some eggs. So if you really do want to have a baby in your 40s, it's not that it's not possible, because we have seen all things, and through all things, there's a possibility. If you want to have a baby in your 40s, it really is worth having a conversation with your primary care doctor and a GYN that specializes in advanced maternal age. And I know it is offensive to call a woman, even before 40, advanced in her age. But that's just really what it is. And it's unfortunate that that's where healthcare has called us. When you're 40, it's not even advanced maternal age anymore. It's called geriatric maternal age. It's offensive. And if you want to put yourself through that healthcare system that we have, where they call women a geriatric at 40, by all means, you are a special woman. But
They call me geriatric at 32 with Mimi. I was like, stop saying bad words. They really did. I had to do so many more extra tests with her. Because they said, oh, you have a geriatric pregnancy. And I was like, I'm 32 years old. Are you serious? But
a
yeah,
lot, a
yeah.
lot. It is the only reason. I don't want to say the only reason, because I feel like it's a lot of has to do with just male energy in
Mm,
healthcare in that setting. But there are a lot of ways that your body is different when you're in your 40s that don't compare to the way that your body is going to respond to a pregnancy when you're in your 20s. And a lot of that has to do with just where we are in life. When you're 20s, you're running around, you're doing all things, you're not really necessarily focusing on your diet, but your life is a lot different.
carefree.
And by the time you get to 40s, if you've had some kids, or even if you haven't, your life is still not the same. So your body's not going to respond the same way that it did in your 20s to a pregnancy in your 40s. And you can prepare for those changes. It goes back to working on nutrition and being physically active. And it sounds corny, but literally, those are the things that your body needs in order to be able to tolerate a pregnancy in your 40s. You have to be physically fit, and you need to be intentional when it comes to your diet and nutrition, because those two things are going to carry you much further throughout your pregnancy than any amount of monitoring and the 1,000 billion tests that you're going to have to make sure your baby's fine. If we want to make sure mom is fine, those things go a much longer, much further in life than all of those tests that they're going to run to make sure your baby's okay.
Well, you are preaching to the choir here because I totally believe in nourishing yourself well and taking care of your body, obviously. Um, so something that's probably more common, I feel like in women in their 40s is bone health and osteoporosis and sarcopenia. And I feel like especially in probably our mom's generation more so than our generation because we have more education on it. But do you have anything that you could share, any wisdom that you could share when it comes to bone health and preventing osteoporosis? Because that's something that's definitely very prevalent in the baby boomer generation, I would say.
I think so. When it comes to our diet, there was a time where milk was like everything. People were drinking milk with breakfast, lunch, and dinner. And so now, when we're kind of moving away from people drinking milk all the time, we need to just be more intentional with where we get our calcium from. So, being knowledgeable about where in your diet calcium lies kind of will take you a long way. Because if you're not eating any green vegetables at all, and you don't drink milk, where are you getting this calcium from? And those are things that you have to be intentional about because it's so easy for people to be like, oh, just, drink some milk, eat some yogurt. But how often are you eating this yogurt? How much yogurt are you eating in the day? Like, you have to be more intentional with how you're nourishing your body if you want to address these things in ways that are sustainable. And resistance activities, just weight bearing activities, walking, just the things that we do every day, those things, again, they just take you further than anything else. But also, having a relationship with a doctor who's knowledgeable about when to talk about deficits or deficiencies in your diet is important because, a lot of Black women suffer from anemia. And what we don't realize a lot of times about anemia is that they're not all the same. When you have to figure out what type of anemia you have so you can address how to replace the deficiency that you have. So you're not just throwing iron at everything because it's not just iron deficiency anemia that causes you to have they have the traditional symptoms, feeling cold, feeling weak, blood flow, those type of things. But other types of anemias will make those types of anemias that we're more knowledgeable about much worse. So having a relationship with your doctor and who's willing to actually navigate and figure out what type of anemia deficiency you have is important. You have to have those conversations so that you know how to replace those deficiencies because it's not always enough to just take some pills to replace where you're lost. Once you replace them, you have to maintain them. You can't maintain them on the pills for life. You got to address it with your diet.
I never knew there was different types of anemias, honestly. I just thought it was iron deficiency and that's it. So that's definitely a great tip because I don't think that's common knowledge about the different types of anemia. I just know people like I'm anemic and I'm low on my iron. So um I just have one more question for you because I'm grateful for your time. How can women in their 40s maintain a healthy work-life balance? Because you're saying we have to nourish well, we have to move our bodies, but we also, especially in your 40s, you have a high demand in the different roles that you play in your life. So, do you have any recommendations for women just to kind of have that balance of taking care of their body, but also not over going like overtraining, over nourishing?
Right. So my best recommendation is you have to find what brings you joy. Like there is nothing you can do for anybody else if you don't check yourself first. So I think really it takes being a little bit self-centered, especially once you've gotten to your 40s. Because like when you were in your 20s, you were so busy trying to like get there that you're not even focused on yourself. You're focusing on all the things you need to do to get to where you're trying to be. When you're in your 30s, you're for some of us, we're either focusing on children, animals, careers, a combination of all of the above. You're not still not focusing on yourself. By the time we're getting close to our 40s, like take advantage of the fact that you have bought yourself some time to focus on yourself right now. Like there's going to be no way to balance work because it's always there.
Mm-hmm.
Family and the stress there, it's always going to be there. The only way to balance that is to take time out for yourself and focus on what brings you joy. Something as simple as what brings you joy. It can be anything. I was watching a show on Netflix and it was called The Mer People. And there is a whole community of people out there that want to be mermaids. And they live a whole lifestyle where they are mermaids. And
Bring
they
it
are living
joy.
their best lives. They have the life.
You're right. And that's something in the Bible and Boot Camps program we have a do you challenge, and it's just do you. And I've noticed that a lot of the women, when they do that challenge within it, I think it's like the third week in Bible Boot Camp, they'll take up poetry, painting, roller skating. I think one took up basketball she hadn't played in years. And the pure joy of doing something that you loved when you were a kid, revisiting that, seeing that you're still gifted and talented in that was so healing for a lot of these women. And it was something that I just had to give them permission to just do them, just do you. So if you want to be a person, do you, boo, like do those things, because life is way too short. And like you said, when we're in our 20s, we're aspiring to get somewhere. In our 30s, we're working on building our family or our lifestyle, whatever the case that may be. In our 40s, we should have a little bit of permission just to do you and have joy. So I want to thank you, because I preach it all the time. You got to nourish yourself and you got to move your body. But we have a doctor here saying the exact same thing. And like, we were just given this one body until we get to eternity, right? And so we might as well take care of it and honor it. And you are such a gift. I'm grateful for you, cousin. And I'm thankful that you took the time. Is there anywhere you want to share for people to connect with you if they might have some personal questions that they have, and maybe you can guide them to what to ask their doctor?
Right. So I have a new Instagram. It is doc.nurse.prac.trees. And you can find me on Instagram. Send me an email, latrice.white@gmail.com, or reach out to my cousin. She knows how to get in touch with me.
Awesome. Yeah. And I will definitely share that in the caption, where you can get a hold of Dr. Latrice White. I'm so proud of her. You are so awesome, cuz. And thank you so much for taking the time to be here. And this is a woman right here worth knowing. So, all right, guys, have a blessed day. And just thanks for taking the time to listen to us.